Dr. Gottlieb, it's good to see you. This news from Arizona tonight, what do you make of it?
Well, look, I think we're going to see other states start to take measures to try to interrupt the spread. We're seeing spread across the South. The trends today in terms of the new numbers was also concerning. 36,000 new cases today. Mondays are usually days when you see less reporting. A week ago, this Monday, we saw 27,000 new cases. So the general trend continues. We're seeing upward trajectory in a number of new cases, and we're seeing that across states like Texas and Florida, Georgia, California, South Carolina, when you look week over week. I think what's really going to affect the epidemic at this point in the South is when people start to take more precautions, and you're starting to see that. You're starting to see reports of people being more careful about their social interactions, wearing masks when they go out. I think when you start to aggregate the collected behavior of individuals taking more precautions in their individual lives, that's going to have a big impact. The actions by the governors will have some impact, but it's not going to really start to reverse these trends. Remember, these are venues that have been open for some time now. In many cases, they're not shutting venues. They're just hitting pause on continued reopenings. They're closing things like bars and nightclubs and stuff like that. But for the most part, they're just not continuing to reopen businesses as they start to see more spread.
Do we need more aggressive shutdowns? Is that what you're saying?
Well, I think we're not going to get it, is the bottom line. So there's no sense in calling for what governors aren't going to do. I don't think you're going to see them close more than just these kinds of entertainment types of venues and sort of recreational types of activities. I don't think we're going to see a broad closure of businesses. I don't think we're going to see broad stay-at-home orders. And so what we need to do is galvanize the public to start taking collective action on their own to limit their activity and make them more aware of the risks of, interactions, social interactions, social gatherings that aren't done in a socially distanced fashion, not wearing masks when you're in large groups, going into congregate setting indoors where the risk of spread is particularly high. If we can get everyone to just take more precaution in their daily lives, that can start to reverse these trends.
You've also raised the issue of whether in some places it's going to be too late to contain some of these outbreaks, specifically as it relates to the state of Florida. How are you feeling about that this evening?
Well, I think when you look at the trends in Florida, they're very concerning. You can make an argument that Florida is in the worst shape of the states. I mean, it's a tough call because we have limited data. We saw hospitalizations go up in Miami-Dade. They separately report daily hospitalizations. So Florida is in trouble. It's going to be slow to reverse these trends. Remember, in New York, we took pretty dramatic action with the stay-at-home orders and the simultaneous shutdown of really all business activity. And we still saw cases continue to build for some time. In the southern states, we're taking more limited action, so there's not a dramatic step that's been taken to really reverse these trends. So if we are going to reverse these trends, it's going to be a slower reversal. We're going to see more cases build before we start to see a reversal here. I think over the next couple of weeks, we're going to see continued increase in cases, and we're going to start to see deaths tragically go up as well. And it's going to be some time before we can reverse this, absent some dramatic action, which I just don't think is going to come.
You're talking about a pretty harsh reality down in the state of Florida, combined with an unwillingness from the governor to shut things down. Where does that leave that state?
Well, I think it leaves us in a situation where we're just going to see more spread. We're going to see people start to, I think, take more actions on their own to limit their activity. We're going to see businesses make decisions on their own to shut down, particularly national chains that have locations in Florida but also have locations in other states. I think, a lot of those national chains are going to make decisions to close their locations in the states where there are outbreaks. We can reverse this. It's not too late. It's never too late. But it's going to take time, and it's going to be hard. I think it's going to be a slower process than the kinds of sharp reversals that we saw in the northeastern states when we implemented tougher measures that were very difficult on the general population, but did have the effect of more dramatically reversing the epidemics. It's going to be hard to do that now. I mean, a lot of these states in the South have been partially or entirely shut down. So to ask the businesses to re-shut down is going to put a lot of hardship on people. So I just don't see it happening. I think the difficulty is heading into the fall when we wanted to reopen business in more earnest. We wanted to send our kids back to school. those are going to be tough decisions for a lot of these states to make. A lot of local officials, I think, are going to have a hard time reopening school districts against the backdrop of this spread. And remember, those schools open earlier in the South in many cases, and so those decisions need to be made probably in early August.
So you're doubting tonight as to whether some of these districts down south are going to be able to send their kids back to school?
I think it's going to be difficult. I mean, you look, especially in the outbreak areas, you look at cities like Houston, Austin, Dallas, the Miami-Dade area. I think it's going to be difficult for school districts, if you don't start to see these numbers come down sharply heading into July, to make decisions in August to reopen those school districts. And that's really the tragic thing from the continued spread in the South. I think we were very focused on keeping businesses open, getting businesses back open, the bars, the restaurants. And I understand why. I know the hardship that the shutdowns impose on small business owners, but we really needed to also focus on the longer term, trying to reopen the schools in the fall. And the backdrop of all this spread is going to make those decisions very difficult. I would expect a lot of local districts to make decisions not to open schools. They don't need to make those decisions right now, but I don't think there's going to be a lot that happens over the month of July that dramatically reverses these trends. Even if we see a slowdown in the number of new cases over the month of July, and hopefully we will, we're really not going to see a very dramatic reversal, because the actions that we're taking to try to accomplish that are very gradual. They're going to lead to a very gradual outcome.